Hello you guys, welcome back to my channel. My name is Dr. Yazdan and today I'm going to take you along with me because I am getting some PRP treatments for hair growth. So if you follow me on Instagram, you will know that I've had some hair loss issues ever since I had my daughter, and I've been combating that with a series of products like shampoos and stuff, and also with PRP treatments. And so my brother does them for me. He is a hair transplant specialist. He also does like laser hair removal. So he helps people get rid of unwanted hair and helps people grow hair in places where it's wanted. So I know that a lot of you followed me on Instagram. I have an IGTV video about my treatments that I did last year. And you could see now like my hair, let me find them for you. Let's see if I can figure them out. Well, okay, so it used to, this all used to be gone. I don't have bangs, but my hair, and it's a lot more than what you're seeing. It's like all over, and it's pretty like a good amount of hair that I lost, that I had like massive bald spots. But now since I've done the PRP, they've grown back. But recently I saw that I was losing a lot of hair in the shower, and anytime I would like run my fingers through my hair. So I panicked and did an emergency call to my brother in his office, and I was like, I need appointments ASAP. So I am going in right now and I'm gonna take you guys along with the journey. So let's go. All right, so I just made it to my brother's office. I'm a little bit late. I'm normally early to every appointment, but I'm like 3 minutes late. So let's give you a little office tour. This is his waiting room. It's kind of like a little man cave because he does a lot of hair transplants. And these are the shampoos that I am always using and talking about to keep my hair from falling out, and it works really well. And then I also use this follicle activation spray. My husband uses these too, so it's really good. And then, surprise, we have the doctor himself. And so I'm excited to get my treatment now. Do you want to say anything?
Pretty advanced selfie stick you have there.
I know. So I'm actually gonna take you into his office and sneak back there and show you what is hiding. There's some surprises. Let's go. So this is Dregger. Dregger is a very special canine, and she's very well trained, and we just love her. So this is my brother's office, and I won't show you the desk because there's some patients' names and we don't want to violate HIPAA here. Okay, so I did this on Instagram a while ago, but my brother has the worst dietary habits. We have bags and bags. These are just two that I grab of candy.
That's because my sister is an awesome dentist. But look what I drink, actually. I drink water. It's water with fruit in it. Yeah, with a little lemon. Look at that. It squeezes it in. For all you guys know, you can buy it. Cool. Yeah, from Amazon. It's like 10 bucks. Put your fruit in there. It kind of squeezes it in there.
Very good. Okay, so first of all, this type of candy is so bad for your teeth. I know this video is about PRP and my hair loss, but it's about this candy right now.
But it's so good.
It is really tasty, but this is so terrible for your teeth. All this sticks to your teeth, and then the bacteria just thrives off of it all day long. If you guys want to eat candy, the best way to eat candy, you should know this, and consume candy, is to have it kind of like all at once, however much you want to eat, instead of snacking on it throughout the day. But I think my brother's entire diet is candy, where he eats it kind of all day long.
This keeps my sister in business, so keep eating candy.
No, don't eat the candy. I don't want to be drilling cavities all day long. All right, so are you ready? Let's go take my blood and do my PRP. All right, yeah. My husband's coming too, so this should be fun. Oh, that one? Okay. I'm gonna draw my blood, and then they will centrifuge it. Can I get that part on video or no? Is there nothing to see? There's nothing to see. Oh, okay. Very good. How many things do you take? Vials?
Just one vial.
Okay, one vial. And they'll centrifuge it down and spin it down, and they'll get all the growth factors from my blood. And then my brother will go ahead and inject it back into my head where he sees that my hair is thinning. Really excited about it. forgot how long it takes before I start seeing my hair stop falling out, but I'm sure my brother could tell me. Thank you. And it's Hubby's turn now. Yeah, you want to take his blood too?
I marked yours already.
Okay, it's already marked. We're going to switch seats. Do you want to be recorded?
Sure.
Okay. This is really exciting because my husband never wants to be on camera, so now he's going to be on this vlog getting his blood drawn and his PRP.
I'm afraid of needles.
You want to hold my hand?
You want to sit all the way back then?
I might start crying.
No, he won't.
Step back for me.
No, I'm kidding. I was totally kidding with you. She's nervous.
You did make me nervous.
How many balls are we doing?
Gotta get an Instagram video too, you know?
Go ahead and put pressure down for me.
Cool.
Thank you.
All done.
Here.
All right. So what we are doing is we are doing something very, very special. We're extracting out the PRP from
What does
her
PRP
blood.
stand for?
Platelet-rich plasma. It's like I'm in school again.
No, I want everyone to know what it stands for.
So we also add a product called A-cell to the PRP, and that is additional growth factors that makes it more effective, and that's why you see it working so well for her.
Yeah. Whatever it is, keep doing it.
So let's go ahead and
You might have to talk loud because the microphone is all the way over there to the thing. Okay, so you want to tell people what you're doing?
So what I'm going to do now is I'm going to start doing these little injections, and I just generally put in about a little tiny drop. And where's Scarlett, by the way? Oh, okay. Usually Scarlett's in her lap, so that's why I ask. You have all this new growth.
I know, but I'm losing.
That's because you stopped coming in.
I know. I didn't do my 3rd session last time.
Yep.
Because it doesn't work with Scarlett's nap schedule.
Well, then you can be bald. You doing okay?
Mm-hmm.
So how long is this vlog?
As long as the procedure is.
So we just go into the scalp very, very, very shallow, just right to where the roots of the follicles are. A lot of places do PRP really incorrectly. They inject way too deep, and it really doesn't serve the purpose it's supposed to. It's also a lot more painful for patients. You can see I don't use any kind of numbing or anything like that, and she's pretty comfortable with it.
One time somebody was like, they're like, oh, you're squinting your eyes every time he injects. When I did the live the other time, and I was like, well, yeah, there's a needle going into my head. Like, you feel it, but it doesn't hurt. But like, yeah, my body has a reaction to a needle going in my head.
It's just like a small little pinch. It's really not that bad.
Where do you see the most thinning?
In the front. The thinning is primarily in the front.
Yeah, that's what I fell into.
So I'm just gonna do a little bit in the back here, and then I'm gonna go back and do the rest in the front.
Should I go with this?
No, you're fine. We're done. Come on back. Yeah, so just a couple more small injections, and we're gonna be done.
What are some post-op instructions?
So basically, I have patients not exercise for that same day. You can go back to normal washing the same day. Sometimes some patients have a little bit of scalp soreness, especially if we do the A-cell. I have them take a little Tylenol, but it's usually best if you don't take anything.
I've never had scalp soreness.
Yeah, most people don't, but every once in a while somebody does, yeah. So I just have them take Tylenol if it's really uncomfortable, but outside of that, you just go about the rest of your day.
How often is this recommended?
Oh yeah, it's a great question.
So I do 4 treatments in the first year, and then 1 to 2 a year after that as a maintenance. She's had like quite a few. She used to show up every day like, hey, my hair is falling out, I need PRP.
Well, I did it 2 weeks apart. How often do you recommend?
Yeah, so I mean 2 weeks apart is when your brother does this for you.
Yeah.
Just to get your sister out of your hair.
I mean, I was bald though.
Yeah.
Like I was really balding.
That's not the normal. Generally, like I'd kind of front load it a little bit, and then I slowly start to taper it out through the rest of the year. We're all done here. She did really well.
One more thing.
Yeah.
Besides how, well, yeah. So how far apart do you do the treatments?
So I generally do like 1 today. Somebody will come back in about a month. Then I have them come back in about 3 or 4 months, and then about 6 months from that point.
Okay. How long till the hair stops falling out?
So that's the first thing we see is shedding start to slow down. And that usually happens within the first 4 to 6 weeks. Patients will come back and be like, you know, my hair shedding is a lot less. And that's when they start to really realize that it works. I'll scoot back to getting the camera. But yeah, so the shedding is usually the first thing that it slows down, and patients tend to see that, come back in for their next treatment, and they're like, whoa, my hair loss has really slowed down or stopped. And that's when they really start to see that it works. And then I tell them they got to be patient, because, you know, getting regrowth or thickening of your hair, that takes time. It's not going to happen as quickly, but over the next 4 to 6 months, a lot of times patients start to see their hair volumizing and starting to become a little thicker as well.
Does one treatment work?
No, one treatment doesn't work. It's a total waste of time and waste of money.
So you should do the 4.
It's like going to the gym once. You know, you don't go to the gym once and run on the treadmill and think you're Rocky.
Yeah.
Okay. Do you do this with hair transplant?
I do, yeah. So I do these with hair transplants as well. Almost all our transplants today, we do PRP with it. And that helps patients heal a little quicker, and they end up getting results a little faster.
My hair loss stops after 2 weeks, usually.
Yeah, so it does.
I know you said 4 to 6.
Yeah, but then you got lackadaisical and you kind of stopped coming in.
Yeah.
Are we gonna vlog my surgery?
Yeah. Okay. So we're gonna get a little close up when my husband's doing his PRP now.
That's what we're gonna vlog, is his haircut.
All right. So a lot of people want to know if the hair comes back like as if you had a hair transplant if you do PRP.
No, so PRP doesn't actually bring hair back. Once the follicle's dead, that's not going to come back with anything other than a transplant. What PRP does is it stimulates the thinning follicles, and it starts to make them thicker, and it reverses some of that miniaturization, and that in itself makes the hair feel like it's thicker. But it doesn't bring you back truly new follicles. That's not really possible. So when we do medical management, it's primarily to slow down or stop hair loss and reverse the thinning that you currently have. It's not gonna work for someone who's been bald for 20 years and all of a sudden they think they're gonna do PRP and all their hair is gonna come back.
Very good. Can I get a close-up of this?
Yeah, you can.
Okay, let's see.
So again, I'm just extracting out the PRP plus the buffy coat, which is where my needle is at. We've also added a product called A-Cell to this, which makes the procedure a bit more effective. And then for this guy, we're gonna use an extra large needle. It's a little bit more painful.
Brother-in-laws.
Yeah.
So where do you see his thinning?
I mean, he's pretty bald right here. We've transplanted him once a couple years ago, but he's definitely thinned out more. So he's been on the books waiting for 6 months for another transplant.
Can we turn your light off, or do you need it?
No, we can turn it off.
It'll give it better.
Yeah, is that better?
Yeah.
Okay, good. She wants me to do this blindly. Do you want me to close my eyes too?
No.
Wow, your last transplant looks pretty good.
Are we gonna be able to make me unbald?
Nope. I'm going to
This PRP will be really good for you, honey.
There's like zero pain.
Yeah. My head feels so good right now. It's like tingling.
Yeah.
And it just feels like revitalized.
Feels good.
I know.
It's already working. Ding.
See how calm the patient is.
You can see there's really no blood, no bleeding or anything like that. You see places doing this and the patient's bleeding all over the place. And every once in a while you get a little spot that bleeds for just a second, but this should be a pretty painless and easy procedure. Shouldn't require anesthesia and all this other stuff people do. It's just a lot of hocus pocus to try to sell you on something that's not really necessary.
Okay, so we just finished my procedure and my husband's procedure, and
The whole time I was wearing the mask, even though we're all vaccinated.
I know, I was going to tell you.
I guess I can take it off. I don't know
Yeah,
what I was
you can
wearing.
take it off. I hang out with you every weekend.
Habit now. It's
like all the time.
2021.
I know.
For some reason, people think these work.
They do work. Don't say that. Okay, so I just finished my hair feels like my head feels so revitalized, and it really doesn't feel like anything like later on. You could be in it. It's okay.
Oh, I'm good.
And so I will be back. I already have my next 2 or 3 appointments
Please
scheduled.
wear your mask next time you come to the office.
I will. And if you guys have questions, leave them in the comments below. Make sure to subscribe to the channel because I have really cool videos that always come out. And maybe I could get my brother to answer your questions. If you guys have questions about PRP, leave them in the comments below. And I will give you guys an update on my hair loss. And maybe we could record my husband's transplant coming up soon.
Have they met Dregger?
Yeah, they met Dregger.
Oh boy.
Alrighty, we'll see you soon.